Hi, my name is Dr. Sive Gallagher. I'm a plastic and reconstructive surgeon. And in this video, we're going to talk about 3 things I find my top surgery patients. And in this video specifically, we're talking about top surgery for folks assigned female at birth. And so we're going to talk about the top 3 things that can take people by surprise. I find in the community, there's certain things that most of my patients already know about. For example, that the nipples are going to look crazy for a few weeks after surgery if we're doing free nipple grafts. And scar care tends to be another thing folks tend to be pretty savvy about. But these are 3 things that we don't really talk about enough, and we're going to learn about in this video. So the first thing I would describe, for want of a better term, is the ick people feel after surgery. And especially if you're young, you're active, and you're used to having a lot of energy, one thing surgery really gives you that lasts about 2 weeks typically is just feeling icky, feeling gross, and just not yourself. So know that that's really normal. The medications we give you at when you get anesthetic can affect you certainly for 48 hours, sometimes beyond that. And just your body trying to recover, it's going to hold on to a lot of fluid. So you're going to be bloated, your stomach's going to be bloated, and you just in general feel off. And even if you're able to shower, like our patients after top surgery are able to shower usually about 48 hours or wherever they're, whenever they're strong enough, even if you're able to shower, you can kind of still feel gross. So just know that that feeling is totally normal. Hang in there, it will definitely pass. So that will be number 1. Number 2 thing that can surprise folks is anytime we do surgery, almost anywhere in the body, there will be swelling. And the thing about swelling is it's always asymmetric, and it can be lumpy, bumpy, and it can change from day to day depending on the temperature outside, depending on your sodium intake. And so this is something that can really surprise folks. And especially if you think about it, if you went for nips, we're obviously going to put the nips where they belong during surgery, and then let's say one side swells a lot more than the other, well, the nips can look all sorts of crazy in the first few weeks. And typically a lot of the swelling is gone around the 2-month mark, but really the appearance of the chest continues to improve over the course of the first year. So swelling is the norm. It's just part of recovery. And again, it's something you usually shouldn't freak out about after surgery because it is to be expected. Point number 3 that can surprise people is the stitchy itchies or stitch abscesses. And so basically, most of us doing top surgery, we put in dissolvable stitches, and in an ideal world, they would just dissolve. You never see them on the outside along your incisions, and you go on about your business. But a percentage of the population, and I personally are one of them, will be quite sensitive to these stitches and spit them. And so oftentimes this will happen in the first 6 weeks after surgery before they dissolve. Typically, most of the stitches surgeons use for this type of surgery are pretty much gone in about 6 weeks, so it is no longer an issue. But during that time, you can often get these little stitch abscesses that look like zits along the incision line. Always reach out and check with your surgeon. This isn't medical advice. Make sure that is actually what's going on, but know that it's extremely common that you will get these in the first few weeks. If you think about it, you got stitches and stitches in there, and it's not unusual for your body to react to 1, 2, sometimes 3. Sometimes people have very bad reactions, and in that case, you'll know that, hey, my body doesn't like those dissolvable stitches if you're having surgery in the future. But that's very unusual. In most of the time, it just looks like little pimples here and there along the incision line. So those are the top 3 things I'd say we probably don't talk about enough when it comes to top surgery, but now you know. For lots more information about top surgery and all the other topics on this channel, I wrote a book along with 9 other experts during the pandemic. It's been available for a while now. It's called Affirmed, and it's available on Amazon if you find this sort of content useful. All proceeds of this book go to charity. And if you like this channel, subscribe, and thank you as always for watching today.